Hi, my name is Kelsey Caston and I'm a student physical therapist assistant, and today I'm going to be talking about Achilles tendinitis in the minimal protection phase. I'll be doing test and measures, and that includes goniometry, medial muscle testing, and special test. For the Achilles tendon, there are two special tests that you can do. The first one is called the Thompson test, and that is used to rule out an Achilles tendon rupture. So your patient will be in prone with their feet hanging off the table, and you will gently squeeze the gastroc and soleus. And if there is no plantar flexion, that is a positive test for the Achilles tendon rupture. The other test to do for the Achilles tendon is to palpate the Achilles tendon gently, and if there is any pain or tenderness, that is a positive test for Achilles tendinitis. To medial muscle test the gastroc and soleus, you will have the patient in prone with their feet hanging off the table. You will stabilize the anterior distal leg, and you're going to palpate the gastroc and soleus. So you'll have the patient point their toes. All right, go ahead and relax and point them again. Okay, now don't let me push your foot down. Hold. Good. To medial muscle test the tibialis anterior, you will have your patient in sitting and have their legs hanging off the table. You will stabilize the posterior distal leg, and you will have the patient point their toes up and in. All right, so can you relax? Yes. And can you point your toes up and in for me? All right, relax. Do it one more time. All right, now don't let me push down. Hold it. Good. To medial muscle test the tibialis posterior, your patient will be inside lying on their test side. You will stabilize the medial distal leg, and you will palpate the tibialis posterior while the patient brings their leg in. All right, relax. And can you do that motion for me? Thank you. Relax. And do it one more time. And don't let me push it. Good. Hold. Good. To medial muscle test the peroneals, you'll have your patient inside lying on their non-test side. You will stabilize the medial distal leg. You'll have the patient invert their foot and palpate the peroneals. Can you go ahead and relax? Okay, turn your foot out for me. Okay, and then you will apply resistance to the dorsal aspect of the foot. Hold it. Good, relax. To measure dorsiflexion, you'll have the patient in sitting with their legs hanging off the table. Your axis point will be on the lateral malleolus. Your proximal arm will be in line with the fibular head, and your distal arm will be parallel to the lateral fifth metatarsal. And on this, you'll be reading the red numbers on the goniometer. All right, can you go ahead and dorsiflex for me? To measure plantar flexion, again, you'll have the patient sitting with their leg hanging off the table. And the axis point will again be the lateral malleolus, and the proximal arm will be in line with the fibular head, and the distal arm will be parallel to the lateral fifth metatarsal. All right, can you go ahead and point your toes downward for me? All right. The normal plantar flexion is from 0 to 50 degrees. To measure inversion, your patient is going to be sitting with their legs hanging off the table. Your access point is between the malleoli, and your proximal arm is in line with the tibial tuberosity, and your distal arm is in line with the second metatarsal. And you will have them point their toes in. Right? And you will line it up with the second metatarsal. To measure eversion, your patient is sitting with their legs hanging off the table. The access point is between the malleoli. The proximal arm is in line with the tibial tuberosity, and the distal arm is in line with the second metatarsal. And you'll have them point their toes out. All right. The normal range for eversion is 0 to 15 degrees.